Hi everybody! In this videos I will be talking about stroke definitions and the stroke types, ischemic stroke and the hemorrhagic stroke. Our outlines in this video include firstly definition of the stroke, then we will talk about the sign and the symptoms of the stroke, and after that we will talk about risk factors of the stroke. Finally, talk about the prevention methods of the stroke. In this slide, we will talk and discuss about how the stroke happens and what is the causes that lead to the stroke and the types of the stroke. Firstly, a stroke happens when the blood supply to the brain is disrupted, either by a blood clot blocking in an arteries or bleeding due to the burst blood vessels. When the blood clot formations in the arteries that lead to the disrupted blood flow to the brain and result in a brain death and cell brain death. This is called ischemic stroke. On the other hand, it's the stroke caused by the bleeding. How the bleeding occurs? The bleeding occurs when the blood pressures in the arteries and blood vessels is increased. When the blood pressure increased, result in ruptures or may lead to the ruptures in the blood vessels. When the ruptures occurs, that lead to decreased blood flows to the brain cells and results in ischemic changes in the brain and the death of the cells. This is called hemorrhagic stroke.
Now I will talk about the clinical manifestations of the stroke. First of all, trouble with speaking and understanding, such as slurred speech and aphasia. Aphasia means that the patient will be unable to pronunciation the words. Second, paralysis or numbness of the face, arm, or leg. The patient here will have weakness and unable to movement in one side or both sides of his body. Third, trouble with seeing in one or both eyes, include blurred vision. Fourth, trouble with walking, and these signs and symptoms are mainly in the ischemic stroke. Headache is the major sign and symptom in hemorrhagic stroke. Here, the patient told the nurse or physician that it's the worst headache in his life.
In this slide, I will be able to talk about risk factors of stroke. Risk factor of stroke classified into two types: modifiable risk factors and non-modifiable risk factors. Modifiable risk factors, that mean we can change it in our life. Non-modifiable risk factors mean that we cannot change it in our life. Modifiable risk factors include alcohol consumptions, smoking, high blood pressure, heart disease, diabetes, obesity, yeah, and so on. Obesity and inactivity lead to accumulation of the lipid in the blood vessels, and that decrease blood flow to the brain and finally lead to the stroke. Smoking. The include nicotine. The nicotine is a vasoconstriction and also lead to the platelet aggregation. All of these factors of nicotine and the characteristic of this nicotine lead to the decreased blood flow to the brain and finally lead to the stroke. In addition to the high blood pressure factors may lead to the ruptures in the vessels and the bleeding occurs and that lead to hemorrhagic stroke. Now we will talk about non-modifiable risk factors that mean we cannot change in our life. Non-modifiable risk factors include age. With increasing age, increase the risk of stroke occurs. Family histories and the previous strokes history. In addition to the genders, in male, the risk of stroke occur is higher than in the female.
How we can prevent a stroke? First, by smoking cessation, because smoking and nicotine cause narrowing in the blood vessels and finally will cause a stroke. Second way, by increasing physical activity, like exercises. Another another way to prevent a stroke by continuous monitoring and controlling for diabetes mellitus and hypertension to detect any elevation in one or both of them. Weight reduction is another way to prevent a stroke by increasing physical activity. Also, we have to avoid saturated fat to decrease the position of lipids in the blood vessels, and that will decrease the possibility of a stroke. Finally, we have to increase fruit and vegetable intake and healthy diet. Now, I will talk about the incidence of ischemic stroke versus hemorrhagic stroke and its mortality. First of all, the major type or the most common type of strokes are ischemic strokes. 88% is ischemic stroke versus 12% hemorrhagic stroke. But the mortality rate elevated in the hemorrhagic stroke is 36 to 37% versus 8% to 12% in the ischemic stroke. Thank you for watching and wish you all the best.